Welcome to Meet the Author. I'm today's host, Sophie, and I'm also the English editor of Author Plus D, the official journal of Asia. Meet the Author is a new column of Author Plus D. It is designed to increase the visibility and readership of the journal. One episode will be released every month. In each episode, we will invite one author to share with us his or her ideas about Asia, the journal Author Plus D, and their experience of getting papers published. Today, we are honored to have Dr. Sachin Abdayan from NSCB Medical College and the clinical research head of Shaobai Hospitals, India, to share with us his insights and experience as a joint surgeon. Welcome, Dr. Abdayan.
Namaste. Thank you so much for the warm welcome. Truly, it is my pleasure to associate with MTA under the aegis of Asia. I am Dr. Sachin Upadhyay from Jabalpur, the city of Holy River, Narmada, India. I am a determined, dynamic, skilled professional and research leader, having over 13 years of rich and insightful experience. Associated with diverse engagement, including joint replacement, traumatology, research, innovation, and teaching in the areas of orthopedics and also implant designing. I firmly believe in living with status of born to win.
Born to win, that is a very impressive motto, Dr. Abdayan. Why do you choose it as a goal of living?
Born to win is an inspirational quote directed toward a goal driven approach. The spirit, will to win, and excel are the things that endure. The will to win, desire to succeed, and the urge to reach your full potential are the keys to unlock the door of personal excellence. I firmly believe that it's not over until you win, so one need to be determined toward the goal and live to win.
This attitude must have driven you to be such an excellent researcher. I firstly want to thank you for contributing your manuscript titled COVID-19 Pandemic and TKA, the concept of a containment sheet, a frugal innovation to the journal. This has been a great article to help protect surgeons against this pandemic background. Could you share with us your method of achieving the containment and how is the outcome?
In present unprecedented time, there is a need of a cost-effective approach that helps in the containment of aerosols generated at the surgical site and minimize the exposure of staff and essential equipments to all aerosolized particles. And this was the rationale behind the use of a containment sheet. The containment sheet was a simple, sterile, impermeable, transparent sheet which was used as a tent over the surgical site as a closed compartment, providing entry to the power saw, drill, electrocautery, suction cannula, and irrigation tube through the controlled apertures made at appropriate site. This sheet was a custom-made assembly as per the area of the surgical site, the lightness, modularity, impermeability, availability in different size, ease in use, inexpensive, and no extra training is required, and also not interfering with the surgical execution was some of the advantages. At times, blurring of the image of underlying structure was the only disadvantage that can be rectified by using more transparent sheets. Before planning to start the use of containment sheet, we have done experiments to compare the difference between using and not using the containment sheet. And you will be surprised, the outcome of using it was fantastic and up to our expectations.
This is great news because it can help protect the doctors and medical staff. And I also learned from your article that extra measures are being taken to protect both the doctors and patients, such as that India hospitals are collecting data about the patients, such as their demographic data, their travel and contact history, etc. I wonder how these extra measures are interrupting your working schedule. Is there any influence on your clinical operation?
The impact of coronavirus pandemic has led to an extraordinary change in our daily schedule and workflow. We have now adapted to new normal conditions. Wearing masks, hand hygiene, and social distancing are now an integral part of the clinical practice. Personally, I miss the healing touch and direct personal communication in present scenario, which is a safe measure both for patients and doctors. Somehow, this is damaging the doctor-patient relationship. Like doctors are now afraid of touching patient in the present scenario. As a joint surgeon, I think the stigma and fear surrounding the pandemic among both non-COVID-19 patients and the medical fraternity present a dilemma for arthroplasty surgeons prioritizing patient for arthroplasty surgery. If elective surgeries do not start for long, then these will become emergency surgeries and survival rate will go down, putting extra burden on the existing health system. Complication tend to be worsened when preventive procedures are delayed.
Yeah, this pandemic is interrupting the health system in every country in every way. Luckily, we've got like excellent researchers and surgeons like you to innovate different methods to counter these difficulties. Since your article is about how to deal with the current situation, it is sent to the WHO for data collection so that other researchers could be shared with the information and learn from it.
That's a great news, Sophie. I'm so glad to hear that. Science is a knowledge based on hypothesis, observation, and experiments. From its inception, science has served the humanity and will continue to do so until the needs of human beings are fulfilled. Every new scientific idea, invention, products deemed beneficial for humanity must be communicated around the world, irrespective of race, religion, or region. These should be free from politics and should not be the prerogative of specific class of society. And this is the way how the WHO plays an imperative role in the global governance of health and disease.
Yes, I agree with you. Scientific communication should never be blocked by politics. I'm glad that both of us has played a part in this academic exchange.
Yes, hopefully, this paper will pave the way for studies which will allow integrating the concept of containment into both the elective and emergency surgeries in the not too distant future. Without Asia arthroplasty support and your encouragement, this wouldn't have been possible to achieve.
Thank you for your compliment, Dr. Abdayan. But actually, I'm glad that we are a part of this academic exchange, and this has been the mission of the journal as well. And to tell you the truth, arthroplasty has went through a little bit difficulties in the first half of 2020 because the publication progress has been affected to some extent, but luckily we've got the support from peer reviewers and excellent authors like you. And as far as I know that this has been the fourth article that you contribute to arthroplasty. We really appreciate your recognition. And in the meantime, we're also greatly impressed by your high frequency of creating papers and doing research. So is there any experience that you'd like to share about how to construct papers more easily?
First of all, I would like to convey my sincere thanks to Asia and Arthroplasty for giving us the opportunity to present and share our work with the world. I must say that I am highly impressed by the efficiency, courtesy, and processing speed of the people like you, editorial team, reviewers, and editors that were managing the communication before and during the COVID era. As far as the tips of writing a paper, if we start discussing on every aspect of conducting a research and transforming the same into a relevant paper, then it would require days. In the view of the matter, I would like to summarize the 7 important steps that may help the surgeon. Firstly, is selection of topic. The topic should be novel and of international relevance. Be very clear about your research goal. Secondly, is finding or observations. Check whether these are authentic and true, whether these findings differ from and add to the previous knowledge. Then pen down the important findings and try to write a sensible explanation to each of these. Up to this stage, you will be cleared in mind that your findings contribute to the existing knowledge. Thirdly, preparing a review of literature. Try to read all those papers which you are planning to cite in your review of literature and summarize their headings. Then critically analyze their strength and weakness one by one. Fourthly, templating a paper. Structure your paper and choose the order that suits you best. I follow a method first, then result and discussion, and finally introduction order. It is most efficient for me. It may be different for you. Fifthly is the language. Write directly in English rather than in your native language. This may be hard in the beginning, but is quicker than translating from your own language. And also, it will help to lift some standard phrases directly or adapted from your model English paper. Sixthly is the journal selection. Choose a journal of high impact factor. The higher the impact factor, the more audience the journal reaches, and the more likely other researchers will cite your paper. Look at their style and think about their audience. What do the editors and readers expect from the article? And the last or the seventh step would be the final assessment. Never ever submit a carelessly written manuscript. Assess your paper bit by bit before submission to make sure each part is relevant and critical.
Thank you, Dr. Abdayan. These are very useful information. They also indicate how difficult it is to creating papers. I hope that our young surgeons could benefit from it after full digestion. Besides being such an excellent researcher, I understand that another important role of you is being an orthopedic teacher. What's special about the teaching compared to doing research? Who are your audience?
Sophie, teaching is a tough job, but it is one where you can make the most impact in another person's life. As a teacher, we give children purpose, set them up for success as citizens of our world, and drive them to do well and succeed in life. My audience are undergraduates, postgraduate students, juniors, and my colleagues. I usually deliver basic musculoskeletal knowledge to undergraduates and specialty, including basic and advanced trauma and arthroplasty skill to my postgraduate students. The main purpose is to provide students with the knowledge, understanding, skills, capabilities, and cognitive styles for making appropriate judgment and decision for themselves, their families, and their communities to serve the ultimate goal of relieving human suffering.
I can see that there is a full purpose for you to teach. What about the experience when you were a student? I understand that you went to different fellowships and followed the gurus like Dr. Vikram Shah and other doctors as well. Do you have any special memories about them? And what do you think are the important factors when choosing centers?
Thank you, Sophie, for reminding me the old golden days. It's very difficult to put in words, but both mentor were strict, charismatic parents who used whatever tactics necessary to motivate me to succeed and excel. My fellowship at Shelby Hospital was a fantastic opportunity to develop my arthroplasty and soft tissue hip and knee skills. I have gained operative experience in both primary and complex, including revision joint surgery, and I am now able to manage patients with all possibilities of hip knee conditions. As for choosing a fellowship center, I concern most about the center quality and mentor. I prefer high volume center for their huge breadth and volume of joint replacement surgeries and regular periprosthetic fracture management as well as constant practice. Experienced mentors who are keen to share with their fellows will also contribute to the experience. As a fellow, one should identify the skills and experience he wants to gain so that his professional and academic goal could be achieved.
Thank you, Dr. Abdayan, for telling us your opinions. This has been a wonderful talk with you. I'd like to thank you again for being here.
Thank you very much for inviting me. I had a great conversation with you. Thank you so much.
The pleasure is always ours to have you here, Dr. Abdayan. This is the end of today's episode. Thank you for being here. And thank you, our audience, for staying with us. We sincerely invite you to submit your manuscript to Arthroplasty. The journal is now still holding the first academic paper contest for better arthroplasty. Participants could submit any research, review, or case report to sign up for the contest and win great awards and opportunities. Please visit our official website for details. Should you have any queries, please send emails to editheffengroup@asiaarthroplasty.org. We also welcome you to follow us on WeChat and Twitter for latest information. That's what we have for this episode of Meet the Author. In the next one, we'll invite another joint surgeon to join us. See you next time. Stay tuned.